So I will be talking about the anatomy of the ear. So this model of the ear shows the different parts of the ear. Ear can be divided into three parts basically. The external ear, which comprises of the pinna, the external ear canal and the TM, the external part of the TM. The middle ear, which comprises of the TM, the ossicles and the other contents, and the inner ear, which is comprised of the cochlea, which is here, and the vestibule and the contents of which are divided into the bony labyrinth and the membranous labyrinth. So the bony labyrinth containing the cochlea and the vestibule, and the membranous labyrinth containing the structures which are internal. We will be talking about all these in detail, and this model shows this is the eustachian tube or the pharyngotympanic tube, which connects the nose from to the middle ear and is responsible for maintenance of the middle ear pressure. The vessel here is the jugular bulb, the sigmoid sinus, which forms the jugular bulb, and this would be the brain. Hello everybody, I am Dr. Narendran, and I will be starting with the module of anatomy of the ear. Initially we will start with the first module, which is the external and middle ear, and then we will progress to the inner ear, and for postgraduate students we will be talking about the middle ear in greater depth along with the inner ear in greater depth. So let us start with the anatomy of external and middle ear. I will start with the Tirukkural. Selvattur Selvam Servichelvam Achelvam Selvattirellam Thalai, which basically means wealth gained by the ear is the wealth of wealth, and that wealth is the chief wealth of all. So the Tirukkural itself explains how important hearing is to all of us. So let us start with the anatomy of the basic introduction of the anatomy of the ear. It can be divided into three parts, which is basically the external ear, the middle ear and the internal ear. So the external ear comprises of the pinna, the external canal up to the eardrum. The middle ear consists of the tympanic membrane, the ossicles and the other contents of the middle ear, and the internal ear, which basically consists of the bony and membranous labyrinth, which are responsible for our hearing and for balance. So this is the hearing pathway. If you look at it, you have the sound which enters the ear, collected by the pinna and transmitted into the ear by the ear canal, and the sound reaches the eardrum, which is the tympanic membrane, and by the vibration of the tympanic membrane, sound is transmitted by the vibration of the ossicles along the malleus, incus and stapes, and on the footplate of the stapes, the fossa fenestra vestibuli is stimulated, and this sound is transmitted into the cochlea, and through the cochlear nerve it then reaches the brain. So this is how the sound is transmitted. You look at it. So sound enters, this is the tympanic membrane, vibration, the ossicles then move, and this sound is transmitted. So vibratory motion is transmitted into the perilymph of the cochlea, and through the scala vestibuli sound is then transmitted, and depending on the frequency of sound which is heard, that particular part of the cochlea is stimulated, and the organ of corti gets stimulated because of this, and then the sound then is transmitted through the spiral ganglion onto the cochlear nerve, and from then on you have two different pathways, which is the direct auditory pathway, where the hair cell stimulation reaches the spiral ganglion, and from there it reaches the cochlear nucleus, and then it travels crosses and then travels to the inferior colliculus, and then to the medial geniculate body and to the primary auditory cortex. The other pathway is, it travels along the same side, synapsing at different levels, and reaches the primary auditory cortex of either side. We will talk about all these in detail when we are talking about the physiology of hearing. So now coming to the external ear. External ear consists of three parts: the pinna, the external canal, and ending in the TM or the tympanic membrane. This is the external surface, external canal surface of the tympanic membrane. Okay, and So this constitutes the external ear. Looking at the pinna or the auricle, the pinna is made of fibroelastic cartilage with the skin tightly draped around it. So there is not much of soft tissue between the skin and the cartilage. And it's got a lateral and a medial part, or an inner and external surface. The Simba concha, clinical anatomy, the Simba concha, which is here, is the external marking for the McEwen's triangle. And the lobule of the ear, this area, is made of fibrofatty tissue. It doesn't have cartilage. Looking at the muscles of the external canal, so we have two different types of muscles, the extrinsic and the intrinsic muscles. The extrinsic both are rudimentary in humans. The muscles are basically responsible for movement of the pinna. Some people are still able to do it, but most of the people are not able to move the pinna in any way. So it consists of auricularis anterior, superior and posterior. So these are the extrinsic muscles, and they are attached to the scalp or scalp aponeurosis or to the skull directly. The intrinsic muscles are between the cartilaginous parts, and they don't have any function as such. Blood supply of the pinna, the primary blood supply is from the external carotid artery. The posterior auricular branch, which supplies the cranial and posterior aspect of the pinna, arises as a branch of the direct branch of the external carotid artery. The anterior part is supplied by superficial temporal artery, and the veins follow the arteries, and the lymphatics are to the preauricular nodes and the mastoid and the level 2 neck nodes, which are the upper deep cervical nodes.